Hey everybody, welcome to Regulatory Joe. I'm Joe Boyle, president of ClearFile, and I'm very excited to introduce our latest topic and special guest speaker, Mallory Mojarro of TrueRx. Our topic today is being a proactive PBM and defining a stronger compliance strategy. Mallory, welcome to the show. Tell us a little bit about your background and how you entered the PBM space.
Thanks, Joe. I'm glad to be here today. I am the manager of licensing and regulatory compliance at TrueRx Health Strategists. TrueRx is a proactive PBM. We try to be a different type of PBM where we put our patients before the profit, and we work with self-funded employer health plans. So that's really where my focus has been.
And so starting in 2024, you are at the cusp of the last 24 months where states and divisions of insurance have increased new policies, increased new mandates and regulations surrounding PBM licensure. You're definitely learning with PBMs across the industry. What are some of the key things that you think a proactive PBM should be looking at right now for, let's just say, anything approaching their first new licensure application, their first renewal licensure application, or even their first report?
The most important thing to start with is having a system in place to keep track of what's due and when. There are so many requirements that it can be easy to lose track of them, the reports and the renewals and the licensure. And then if you get follow-up emails, keeping track of those deadlines can be difficult. So any type of system to keep track of that is good. ClearFile is great for that. We've partnered with ClearFile to keep track of deadlines, and that's been very helpful. Making sure to stay up to date with pending legislation is very important, especially we're seeing right now there's a lot of bills in the legislature that can potentially have a major impact on requirements, where new licensure requirements in different states and new report. So keeping track of that, just making sure that you've done research as to what each state requires. So before starting a licensure application, I like to start out on that state's website and understand what they require, maybe review their PBM statute and what types of documents they need. And I find that there's better outcomes if you reach out to the statutory authority, the Division of Insurance, or whomever it may be, and see them more as a partner than an adversary, because they're often more than happy to answer questions or clarify what they're looking for so you can get it right the first time.
Absolutely. Communication is key, and over-communication at best. Building those relationships, having regulators and reviewers understand who the PBM is, what the purpose of their business is, their value proposition and their mission statement is critical. And like you mentioned, so aside of all of the nuanced requirements, spending the time and actually taking the time to have the phone calls to ask the questions as needed is worth the time investment. And like you mentioned, having a centralized, I guess you could say, repository or workflow system is definitely key, because more often than not, as we're looking at the industry, aside from TrueRx, PBMs are using, everything from Excel spreadsheets, sticky notes, OneNote, Microsoft Word off the side of their desk to try to track these complex requirements. And that's ever changing. So while states do communicate with one another, each state has their own unique set of primary requirements as well as secondary requirements. Some have varying deadlines, some which include time-bound submissions. I have to be remiss to say, resourcing and staffing is critical. So, Am I safe to assume you're a dedicated resource to this work at TrueRx? And who else are you working with internal to your organization? I have to assume it's a level of other folks on your legal team, other folks in your finance area, even down to, let's just call it analytics or data and reporting. So I'd love to learn more about how you are triaging with your stakeholders to make your proactive PBM so successful.
So compliance is organization-wide. You can't make decisions in a silo when it comes to compliance. I do focus mainly on compliance. We also have our director of compliance, Vicki Bohannon, and our general counsel, Mike Chestnut, who are very involved in compliance, obviously. We utilize data and assistance from our analytics team, especially for reporting requirements. When a state asks us how many claims there have been, or how many rebates we received, and what was passed on, and what clients are in which state. They're a great resource for that. We work directly with our legal team, especially when interpreting statutes and regulations. And when ERISA and non-ERISA questions come up, that's a big topic of discussion. We keep our executive team apprised of what's going on. They're involved in licensing decisions and instituting any required statutes and regulations organization-wide, because there can be changes that affect the entire business and not just what type of report we file. And then we rely on our finance team to provide any type of financial information that's needed from each state. The states, when they ask for information, they want a little piece of everything in the organization. Just one particular piece of information. They want a whole picture of what the organization is doing and how we're doing.
Right. No, and you nailed that right on the head. And as your organization grows and evolves, we've also seen pharmacy benefit managers augment and alter their plan strategy, whether they're ERISA self-funded or fully insured. Groups and members, even with strengthening PBM requirements, look to move their geographies, whether it's exiting a state, entering a new state, looking to forge new business elsewhere, or even leveraging these complex requirements. For example, states that require a PBM to be PBM licensed and also TPA licensed. We're seeing PBMs leverage this additional TPA licensure requirement to then be able to say, well, let's make this an opportunity. Well, it's a new requirement for me. What can it mean for my business and what can I do? So while the industry historically looked at licensure filing as an administrative body of work, it is actually highly strategic in terms of how a business should be looking at this compliance work. Compliance work is always required, it should always be funded, and it's actually more strategic than we tend to remember. I'd love to hear any other insights as to what you're learning from this process. So as a paralegal and then just absorbing all of this information, you must have learned a lot about the business and probably are even able to make process recommendations, standard operating procedures, and building your well-oiled machine. Because what we want other PBMs to hear is what proactive PBMs are doing so that they can learn from folks like TrueRx.
TrueRx has clients in most states, so we have taken the proactive stance to become registered in each state, and that allows us to be ready for when we do get clients in a particular state. We're not behind the eight ball and rushing to get licensed somewhere after we have the sale made, or we're working on an RFP with a client. We're already ready to go. And so that's been a business decision that our executive team has made to keep us ready for clients, no matter where they come to us from. We prioritize based on how many lives we have in a state. We do look at the cost. Some of these state registrations are in the tens, thousands of dollars and can be quite expensive. And then the reporting fees and any type of bond that's required can all get very expensive. So we do make decisions based on that. As of right now, we still have gone forward with registration in each state where we're able to, because that made sense for us. I think the most important things that I'm looking at as far as the business and tying that into compliance and different licensure issues is the state regulations and legislation that's coming through. There's dispensing fee mandate now, and which states require point of sale rebates or have prohibitions against fees levied against pharmacies for certain programs. So those are all regulations and laws that impact what programs we can offer to our clients. So keeping our executive team apprised of what the new laws are and what we can do according to the statutes. And so maybe that means we can do a certain program in one state but not another. And that can be difficult to understand sometimes. And then when new laws come out and they become effective nearly immediately, that can keep things interesting. So compliance at first seemed like it might just be a lot of reading statutes and filling out forms, but it requires a lot of agility with doing programs differently based on what's allowed in that state. or reprioritizing licensure or a certain registration because of that. What I'm learning with compliance is that it's about continuous improvement and not about being perfect because it changes so much. My prior experience as a paralegal was to meet every requirement immediately. And it's different in compliance, especially in this licensing and registration with the states, in that you're becoming more compliant by the day and you're meeting new requirements as they come up.
What you just touched on is you're not just doing this to check a box, but you are educating your internal team, you're educating your leadership, you're educating your stakeholders so that everybody's involved and everybody truly needs to be accountable across the organization, including the business, not just compliance. Over the past 24 months, I think you and all PBMs out there can agree that states have been strengthening guidance. And what we can anticipate is that's not going away. So I would love to hear, because there's regulation and then there's talks of what we could consider to be overregulation. We need to truly understand why regulators are creating rules, because rules are in place for a reason. But what I've learned and what the business has learned is some rules are disproportionate or could impact PBMs disproportionately based on size, based on capabilities, and many other factors. For example, a startup PBM is going to have a much different experience entering a state like New York with over a $20,000 licensure application fee just to participate. For a larger PBM, that could be much easier to do. So I would just love to hear your general thoughts, because TrueRx being, a proactive PBM, what should proactive PBMs be doing, or what should PBMs be doing to be proactive as it relates to evaluating disproportionate requirements?
We're a medium-sized PBM. We're a transparent PBM. A lot of the regulations that come in may not even apply to us because we already don't do those things. We don't have spread pricing. So a lot of the things I'm seeing come out may affect other PBMs more. New York, for example, has their cybersecurity rule. And while those regulations are great and are necessary for a medium-sized company, it can be difficult to meet every requirement when it's due. And that can be a big lift. For example, with that, we have to then get our IT and security teams involved and make sure that we're meeting all of those things. When in the past, we might have just been more used to dealing with HIPAA compliance and privacy compliance. And now we have states that are stepping into actual cybersecurity compliance, or states that require a significant amount of reporting. They want claims data and rebate data. And if you have a large footprint in that state, that can be a really big lift on the company. What I'm finding is, though, that there's not really a lot of ways to get out of these reporting requirements. When we see a new law, we see a reporting requirement, we evaluate it to see if it's something we have to comply with. Does it only pertain to ERISA or non-ERISA? Does it only pertain to self-funded or fully insured? But when you get to the point where nothing exempts you from it, there's really not a way around it. And so proactively filing the report, even if you don't like the requirement, I think is just kind of what has to happen. We appreciate ClearFile communicating with regulators and, opening the conversations of why are these items required? I find that when they ask for a lot of claims data or copies of contracts and things like that, is someone really reading these things? Are we submitting it for a reason? Is the state gathering any type of usable information from what we're submitting, or are they just requesting it to put a burden on PBMs? I'd like to think that's not why they're asking. I know PBMs in general can have a bad reputation, but I'd like to think that they're asking for the information because they're going to use it and use it to lower drug prices or help patients and the industry in general. But at times it can seem like it's just arbitrary and they're asking for a bunch of information that may or may not be actually used.
I'm so glad you brought this up too, because the intention of reporting and the intention of filing is very real. Far too often, for anything that gets submitted to a state, or CMS for that matter, whether it's Transparency and Coverage or Freedom of Information Act, just to make sure that people can request access to information at a later point if they need it. The question is why? So I think it's a completely reasonable question to ask, just to understand simply how states are using the data, what insights they're deriving from it. And what we've learned is, generally speaking, what states are learning from their review of PBM submissions is driving the new policies that they're creating, so year over year. But that being said, there is an issue because each state division of insurance is staffed very differently. So what we've also seen is some states are staffed with a single point of contact, and that's the single person's job to ingest all PBM submissions and review those submissions. And generally speaking, it could be first in, first out. Doesn't matter how big a PBM is or how small you are, how much money you make or how little money you make. First one to submit an order gets the review started, and then we get you chip down the list from there. Alternatively speaking, other divisions of insurance are more robustly staffed. Even thirdly, some divisions of insurance are still developing their policy requirements that don't even exist today. So getting ahead of that, we're seeing a lot of activities across all states. And we do know that generally speaking, they harmonize over the umbrella of the NAIC, the National Association of Insurance Commissioners. But what we do know is the facts. States will continue to operate independently. They will continue to offer their own guidance while still collaborating with one another. Are there any other questions that you'd like to ask regulators, or you think other PBMs that want to be proactive should be asking regulators in the day-to-day?
I would like to ask regulators, like I said, why do you need all of this information? Is it really being used? Especially the reporting requirements. When we're reporting how many claims we've had in a state and when they were paid, is someone really looking at that data and saying, okay, as an average, PBMs are taking 7 days to pay a claim. That's too long. We should report to our legislature so that they can statutorily require PBMs or regulatorily require PBMs to pay sooner. Or we're seeing that PBMs are retaining, 60% of the rebates. That's not right. We should go back and have this changed. So if they're using the data, I think it's worth it to report. But it's a lot to ask if it's not actually being used. And to your point, there are a lot of offices that have a very lean staffing model. There's often only 1 or 2 people that are handling PBM licensure or reporting in states. There are states where you submit a report and you don't even hear an acknowledgement that they got it. And that can feel frustrating because, this report was required, but the state doesn't even confirm they received it from me. Are they really using this information? And I feel for the states because often the legislature passes a bill, passes a new law that requires a lot from their office, but may not have looked at the impact and staff enough people to deal with the new change. We saw this in Arkansas with Rule 128 reporting earlier this year. We've seen it in Kentucky when the dispensing fee mandate came about and complaints could be filed by pharmacies that weren't receiving it. But there just weren't a lot of people in those offices to handle the influx of communication they were receiving. So I think that holistically, as the legislature portion, the departments of insurance, the board of pharmacy, and then the PBM could all communicate a little bit better about it and work together more. Because ultimately, as TrueRx, we want our patients to thrive. We want to assist our employers to provide benefits to their employees. And we want to, meet the regulatory requirements and stay within the law. And all of those goals can seem to be conflicting, but they're really not in the end. We just want to have prescription drug prices be lower for our patients, and the legislatures want to make sure that we're following the laws they put in place, and we want to follow those, but it can be difficult to meet their requirement.
That's a great point, Mallory. And I think so. When you said what would be helpful for PBMs, proactive or not, strengthen communication between divisions of insurance, pharmacy, or board of pharmacies, any other bureaus is critical. For any PBMs listening out there, it's going to be important to proactively reach out to your regulators, forge those relationships, and show up. The rules that you cited, whether it's Arkansas or Kentucky, there's even 14 states across the country that require audited financial statements. There's a small handful that require fingerprints, and almost all require biographical affidavit. I think the message here, Mallory, is making PBM licensure a part of the day-to-day work of everything that you perform within a PBM. Not to deprioritize it, not to seasonally staff it. We need dedicated resources as an integrated workflow, an integrated part of any PBM strategy. And I think what you also touched on, which is highly valuable for many PBMs, is being proactive, regardless if a state is understaffed, regardless if they have the resources or if it's going in the dark and you're not hearing back and you're still conducting business operations. The requirement's the requirement. So I think that you've given us a lot, you've armed us with a lot of good advice on how to get there. So Mallory, I know we've covered a lot today and this has been incredibly helpful. Now, when we think about life before pharmacy benefit managers and being part of the industry, we see far too often this being a newly required body of work, licensure in general. It historically hasn't been a full-time role for a lot of PBMs or any other organization for that matter. And that's what makes folk like you and like us very successful with what we do, is what we're learning is working in the PBM space is complex. It's not for everybody. It takes a lot of patience. It takes attention to detail. So what type of person in this role, like picking the right resource, the right person, a partner in crime, what type of person does a PBM need to support this work?
I've always said that I like paperwork, but someone who is energized by the new challenges that come about. When I see there's a new law that was passed, I don't dread it as much as some other people I know. I want to dig in and find out what the new requirement is and how do I meet that requirement. It's just a challenge instead of a personal affront to me that the state decided to pass that law. They're not coming after me or my PBM specifically. They're just trying to make this industry better. I came from the relocation real estate world, so very on the surface seems very different than PBMs and the pharmaceutical industry, but in reality helped me a lot because in the relocation real estate world, you have companies that are moving their employees and each state and each employee and each has their own requirements. So I came in used to the idea that each state has their own specific idiosyncrasies and requirements and statutes that change how we need to do business there. And that's helped me a lot in working on PBM licensure and keeping up with legislative changes in this industry, because I'm used to working with those different regulatory bodies and keeping track of changes that are made and how those impact our business and our clients and our day-to-day. So while at first it seemed like this wouldn't fit at all, it really does. And there's a lot of paperwork and forms and very specific details that go into that industry as well. I used to say when you're typing a legal description, if you have the wrong lot number, you've sold a different house. So when you're working in the PBM industry and there's a statute that requires you to be very specific about rebates that you paid or claims that were denied or approved, you have to be very specific about what number goes in that line when you are submitting it. And so that type of attention to detail where one number means that you sold the wrong house or you reported the wrong thing, it was ingrained in me already. So that really helped me coming into the PBM world.
Wow, that's so valuable too. And that's also fascinating because that, it reminds me of all of the attention to detail that's required for even a Secretary of State application, or the different complexities between being headquartered in one state and having brick and mortar buildings in other states, and operating remotely in multiple states in addition to that. the point I want to make to the industry is this work doesn't have to be scary ultimately. This can be a desirable body of work that develops a very successful career roadmap for folks early in career, mid-career, or even later in career. So this shouldn't be something people are running away from. This should be something that should be approachable to have people excited, waking up, energized, and enlightened to actually dive into this work and make it like a healthy competition. So the last 24 months of the PBM world has been busy. Where do you think the next 24 months is going? Let's just say by the time we get to 2027 or 2028.
I think we will continue to see more laws put into place that regulate PBM, regulate us significantly in certain states. I think that it will calm down because there's only so many ways to regulate a PBM. You can only tell us so many times not to steer, spread price, or charge fees. So I think once most of the states that want to put those things into place, that it will become more routine of filing your reports. And, once every state requires licensure, then we're not waiting on any state to start requiring licensure. We're just looking at staying in good standing in that state. So I think that while there are a lot of regulations, and there will continue to be probably for another year or so, that eventually it will smooth out where most of the states are requiring a lot of things, but they're all similar. Because I think there's a finite amount requirements you can decide to put on this industry unless something else new comes up, which it might, because that's kind of how this works and what keeps it interesting.
Thank you, Mallory. I would agree that over the next year or two, we will see that influx or a continued influx where we would still advise PBMs to advocate during a continued year of change. So Mallory, we can't thank you enough for the time today and for the valuable insights. And if you'd like to leave us with any final thoughts, where can we find you and how can we keep in touch with you?
Thank you so much for having me. It's been a pleasure. You can find TrueRx at truerx.com, and we can be reached at hello@truerx.com. Check out our LinkedIn page, and I can be found on LinkedIn as well, Mallory Mojarro. And I'm just excited to see where the PBM industry takes me next, to see TrueRx grow and as we implement and ride through the roller coaster of what happens next with legislation.
Thank you, Mallory. No, and I hope many PBMs benefit from your valuable insights and ultimately reach out to you and TrueRx. That's a wrap for today. Thank you, everybody, for tuning in. Give us a like, give us a share, and we'll see you all next time.